It's been a bit of a strange show today because we've had Tony Blair saying that the EU have behaved foolishly, Rachel Reeves there saying they haven't covered themselves in glory, both Remain backers, and yet Liz Truss, who voted for Brexit, was kind of stepping back from criticising them. What's your view on the EU's actions over the vaccine supply this week?
Well, they got it completely wrong, and I think the government is being very wise to lower the temperature in a situation like this, because this year the big threat, which is not something many people predicted, is around these new variants, particularly from South Africa and also Brazil. And if we are going to tackle these new variants, and they could happen to be South Africa and Brazil this time, it could be anywhere else next time, we are going to need to have high levels of close cooperation and collaboration across the world. We all know the problems that happened because we didn't find out about the virus in China as quickly as we might have. So we really do need to be working closely with everyone, and we have the capacity to do that in this country with our world-beating genomics capacity. So that's why I think this was a huge wrong step for the EU to take, but I think it's very welcome that it's been resolved.
You're talking there about the threat from other variants springing up around the world. Of course, we only know the ones that have been discovered. There may be more. Do you think that means that once the UK is vaccinated the most vulnerable, we should look at vaccinating people in other countries as well?
Yes, I mean, we've got 367 million doses. We won't need all of those. Right now, we're in a race because we do have the UK variant, we have some of the South African variants, some of the Brazilian variants here. And we need to vaccinate, if we possibly can, the whole adult population, but certainly to the levels to get herd immunity before some of these new variants really take hold, because some of the ones in the future may in fact be immune to the vaccine. And what you want to do is to get transmission as low as possible so that when those new variants arrive, you can really do the detailed contact tracing, what they call the deep contact tracing, to isolate people very, very quickly indeed. But you can only do that when transmission levels are very low. So it's a race against time at the moment. But I have to say the vaccine programme is going extremely well. And I think we have every chance of succeeding in that.
Once transmission is down to what we hope to be very low levels, what other countries should we prioritise giving vaccines to? Are you thinking of like the lowest income countries, the ones with most travel to the UK, the ones who are our closest neighbours? What's your view?
Well, I think it goes without saying that we're not safe until everyone's safe. And I think one of the parts of the world where we could make the biggest difference is Africa. And in particular, the Oxford AstraZeneca vaccine that we developed in this country has the biggest potential to be transformational in Africa because it can be transported at low temperatures and it's very cheap. And indeed, AstraZeneca have said they don't want to make any money from it. So costs will be much less of an issue. So I think with our large aid budget and our huge connections in Africa, that is certainly a part of the world where the UK could make an enormous difference.
We all know, of course, that one of the biggest threats at the minute is the emergence of these new variants. Some of them are more transmissible, some of them there are concerns about vaccine efficacy. Now, 4 weeks ago, on the 4th of January, you tweeted calling for international travel to be stopped. You said, we cannot afford to wait. Now, in those 4 weeks, 9 cases of the Brazilian variant have been found in the United Kingdom. The number of cases of the South African variant, we believe, has more than trebled. I mean, I know these figures, are estimates, but things have clearly gone in the wrong direction. Were we much, much too slow to impose border controls, and do we need to go further now?
Well, I'm much happier now than I was then because we have put in place some important restrictions and we've got quarantine hotels on the way and so on. But the big point here is that we have an advantage because we're an island and it's much easier for us to control travel in and out of the country than it is for countries with a lot of land borders. And the lesson of this virus is that the countries that were most successful were the countries of East Asia, South Korea, Taiwan, Hong Kong, Singapore, and they imposed travel restrictions very, very quickly. But that's not the only thing they did. They took the whole business of quarantining people who might be infectious much more seriously. And I would say that the borders are one gap, which I think we are starting to plug. But another very, very big one is the fact that Dido Harding said only this week 40% of the people who are asked to isolate by NHS Test and Trace don't actually do so. And that works out at about 240,000 people every week, a number of whom are still going to work, incidentally. So I think one of the big things we've got to look at is how we are much, much more effective at getting people to isolate who we need to.
How do we do that, genuinely? I mean, I've just isolated for 10 days after contracting COVID. I was called by Test and Trace very quickly. They called me fairly regularly throughout my isolation, but they only had my word that I was staying at home. Genuinely, how do you actually make people isolate?
Well, there are different methods around the world. In terms of the enforcement of it, regular contact, I think, is very important, and excellent that you had that. There's also use of technology that they've been doing in Poland and Taiwan. But I think the single most important thing is to give people the confidence they're not going to be out of pocket financially. And I think we do need to say to people, this is a public health matter. If you are out of pocket in terms of your salary, while you're in that self-isolation period, the government will make up the difference. I think it just needs to be very, very straightforward so that people understand they're not going to be out of pocket from following these instructions.
So the current government scheme needs to go further then?
I think it does, yes.
OK. Now, I want to talk to you very quickly about vaccinations and teachers. Tony Blair earlier on the show, also, of course, we know Rachel Reeves from Labour, calling for teachers to be moved up the vaccination queue to get schools open more quickly. Tony Blair thinks that you could potentially vaccinate all teachers in just a couple of days. Do you think he's right?
Well, I think it's a very compelling case. I had a discussion on Friday with the Vaccines Minister, Nadeem Zahawi, with some campaigners from Godalming who are, in my constituency, very, very keen to see teachers vaccinated. But you do need to look at the proper scientific advice. And the chief executive of my local hospital, the Royal Surrey, tells me that her critical care beds are really full of the people between 60 and 75 at the moment. And so for her, in order to create more capacity, it is a real priority to get that age group vaccinated. So I think if we can do the teachers, everyone would want to do that. But we just need to listen to that scientific advice to make sure we get the balance absolutely right.
Now, we are running out of time, but there was just one sort of off-COVID question that I was keen to ask you. When I was researching the interview, I read the interview you did with The Observer last week, where you said that Keir Starmer appeals to moderate people living in my constituency in Surrey in a way that no Labour leader since Blair has ever succeeded in doing. Are you a bit worried about the threat that Keir Starmer poses to the Conservative Party?
Well, I think he's a very serious threat, a much bigger threat than we've had for many years. Indeed, since Tony Blair, who you just had on your show, I would definitely say that, yes. But on the other hand, this could be a very exciting period for this country. And if you look at what is, I think, generally recognised as the most successful Labour government since the war, the Attlee government, they were running the country in a period after a great crisis, the Second World War, but they showed enormous imagination in the setting up of the NHS in 1948. I think we could turn this into a 1948 moment for the country as we come out of this crisis by completely reforming the social care system, giving it a proper 10-year plan, sorting out the workforce issues in the NHS, getting our cancer survival rates to the levels of France and Germany. I think sometimes there are opportunities in these terrible crises, and if we grasp those opportunities, Boris Johnson really can show the country that we are the party of the NHS, which is something I know he very much wants to do.